Clavicular osteolysis is a condition that describes a set of symptoms at the distal clavicle, where it articulates with the acromion process, that is due to really two separate issues almost every time. The first is degenerative factors based off of repetitive injuries and abuse, but more commonly it's from direct damage, typically a clavicular fracture that, in addition to being fractured, will separate the AC joint, meaning that it will damage the ligaments that articulate these two bony structures. In doing so, it creates a cycle of inflammation, and without proper and immediate rehabilitation, will begin to evolve from inflammation to further what they call microfracturing, where the healing doesn't occur in the bone due to cyclical back and forth aggravations, and eventually could lead to arthritic degeneration of the acromioclavicular joint, which would require surgical intervention. When identified, when you recognize these symptoms at the distal clavicle, and pressing into the AC joint elicits an unexpected and shocking pain, to say, for lack of a better term, a kind of reflexive pain that you wouldn't get from muscles outside of recent injury, you have pretty good reason to be suspicious that the joint itself is irritated. It is wise at that point, if all of the speculative conditions are present, i.e. they're old enough that degenerative processes could be occurring in combination with certain activities, like if they were a painter of ceilings or a mechanic where they were overhead often, that would create a situation over many decades where degeneration would be possible, or there is a recent history of fracture in the area that hasn't been followed by pain relief. Going in and getting a second look to see if there's any damage to the ligaments could solve the problem, as manual therapy really doesn't do a lot for clavicular osteolysis.